The Sleep Medicine Fellowship Program at UCSF Fresno entails the whole spectrum of sleep disorders. We train our fellows to be experts in sleep medicine in all the 6 areas of sleep medicine.
This program is one of the most well-established programs in California, and over the years we have refined our training curriculum to meet the all benchmark and exceed what's set to us by ACGME. And usually by the end of their 12 months of training, they will feel very comfortable taking care of wide spectrum of sleep medicine patients, from the bread and butter obstructive sleep apnea to restless leg syndrome, narcolepsy, and other sleep-related pathology.
With the training I'm receiving at UCSF Fresno, I feel very confident about managing a variety of sleep disorders. There's a whole host of sleep disorders that are not only there in existence, but we see them very closely and we manage them on a regular basis, that when I am out there practicing on my own without supervision, I feel quite confident that I'll be able to manage them.
One of the best things about the program that I walked into was the fact that I was getting a hands-on experience right away. This program serves a huge amount of community in the Central Valley. The amount of patients you can see is limitless, and that gives us an exposure of patient pathologies of all various kinds. And so whenever we walk in and see different sleep medicine consults, it's always a surprise as well as a challenge, because there's always something else that we will find.
One strong area of my own personal interest is research. So we strongly support our fellows with the research projects, research ideas. We have a strong area of research in restless leg syndrome, but we want to build research in health and disparities, obstructive sleep apnea, neurocognitive deficits. Fresno, we have a strong Alzheimer's and dementia center, and we're building relationships with these other colleagues to support and build a strong research program.
Additionally, we also rotate through Pediatric Sleep, and we go to another office that helps us read different sleep studies that are 1-year-old, 2-year-old, and that gives us a different perspective of how different sleep medicine clinic works, as well as gives us an idea of what it means to learn about how to interact with kids and how to interact with adults, and those different perspectives. Lastly, we actually also rotate through sleep dentist, which is a really cool way of learning about different oral appliances and different things that's really been useful for them. Seeing the other side of the referral is really essential in terms of knowing what we need to do to make sure that they are also getting it's a fast process, it's a smooth process, and they can help the most they can.
One of the major appeals for me personally was the fact that our program director and some of our attendings we work with, they're essentially pioneers of sleep medicine in the Central Valley. And personally for me, it's not only a privilege to work with them, but you also get to see the inside workings of what sleep medicine entails. You see how you can essentially establish a new field in a new area, and when you're working with pioneers such as those, you get a lot to learn.
We pride ourselves for having a big, diverse and inclusive program and society where fellows are going to be exposed to different pathologies, different societies, and to colleagues that come from different backgrounds. So we appreciate the contributions that people from different backgrounds, both medically and culturally, offer to our program.
I think what attracted me to this area is its mild climate, its proximity to national parks, and being centrally located in California. I can equally drive within 3 hours to either Los Angeles or San Francisco Bay Area. Part also of living in Central California is enjoying fresh produce.
I'm an avid hiker, and I love hiking in national parks, and that's what I did in Hawaii, and I was able to continue that doing it here as well. So you're in Yosemite or Sequoia National Park or Sierra National Park, even going as much as to Lake Tahoe, all those things are within reach. You can go, drive 2-3 hours and you're good. And so I like the nature. I like to spend time with family. I have in Northern California versus Southern California, family all across California. So I'm able to drive and make it to every event I can. So it's a very central area for me. And so that's why I like Fresno.
One of the strengths of the fellowship is the close relationship that you will have with your mentors. Having a mentor in sleep medicine is invaluable, both for your training and for your career. You can just search us, search my name, and you will find all the amazing and fun things that I'm doing globally, locally, and in the sleep medicine world. This knowledge, this close mentorship will guarantee that you're not only a successful sleep physician, you will successfully pass your boards, but you'll also be able to make a strong impact in society.